So let's review what we know about tolerance, dependence, and addiction. This textbook gives these three definitions, and I'm sure we can all recognize these when we see it. Tolerance and dependence, they are both processes that can happen to anyone and do happen to anyone if they have to use a medication for a certain amount of time. With tolerance, you see the same amount of a drug producing a decreased effect over time because the receptors become accustomed to that drug and that amount, and they stop producing the same effect. So you will see the person taking the same amount of opioid but still suffering pain as a result. Now, the hope is that as they get tolerant to the drug, their pain is decreasing. So this would be true after a surgery. There's pain the first day, lots of pain the second day, usually, as those nerves start to wake up and go, what the heck happened? But usually, as the days go by, the pain begins to lessen as the incision heals. And hopefully the rate of tolerance kind of keeps up with the rate of decreasing pain. You break your leg, that's pretty severe pain. And the drug might hold you for a while. You start maybe with one oxycodone tablet, and then you notice that after a few days that one just doesn't do it, and you need two. Or you can't go just 4 hours anymore or 6 hours anymore. You need the drug every 4 hours. And that's just a natural result to anybody taking a pain medication. And it doesn't even always have to be a pain medication. It can be other meds too. Dependence goes a little bit farther. Usually you see this in somebody who's got to take medication for chronic pain. And in this case, the body is actually dependent on the drug to function. And if the drug is lessened or taken away completely, the patient's going to have withdrawal symptoms. They're going to have the physical symptoms of sometimes nausea, vomiting, body pain, fever and chills, diarrhea. They're going to have emotional stress and anxiety because this drug is taken away. And that's just natural. After a certain amount of time, your body requires this drug to function properly, and tolerance and dependence can happen to any of us with any drug at any time. Now, addiction goes a step further. The book gives a very simple definition of addiction. It says the uncontrollable need to have and use a drug for non-medical reasons. And that's partially true. Maybe the dire need for a drug has passed, the incision has healed, or the leg is starting to knit together, and technically that pain could be relieved with something more mild. But in this case, the person's used to it, they like the side effects and how it makes them feel, and they do not like the withdrawal effects when it's taken away. But I'll go a step farther with addiction, and addiction I think enters a realm where the person becomes desperate for the drug and they will do anything, even if they have to break the law. If you can get a person who's dependent on a drug, you get somebody with chronic pain and they're at a pain clinic and they're following the drug regimen. Yeah, they're dependent on that pain, but they're able to keep working, they're able to keep going to school, they're able to keep functioning. In fact, the drug helps them function better. They don't resort to taking more medication than is prescribed. They take it as directed. They make regular visits to the pain clinic for all the follow-up that's needed. And yeah, if you took it away from them, they would suffer psychologically and physically, but they're able to keep going because of this med, even though their body's dependent on it. But with addiction, you see the need for the med escalating. People will often take more than they need to at any particular time, and so their prescription runs out, and they will do whatever it takes to get more of that drug. They also will break the law many times and go farther for that drug than they otherwise would. And there's a certain element of addiction that is still treating pain. We have a very flawed mental health system. We have a lot of people who are dealing with mental health issues, and due to lack of availability or lack of payer resources, they are not able to seek help for their various mental and emotional issues. And sometimes they find that when they start taking opioids, that psychic pain, that mental and emotional pain, is temporarily relieved. And so a lot of our addicts are treating emotional pain rather than physical pain. I think that's a real aspect of addiction. So this is just something else on a scale of 1 to 10. Would you say that nursing school is an 11? Yeah, probably. All right, so let's look at the different categories of opioid pain meds. And again, I'm sorry that this is jumping around. My arm is getting really, really sore from holding it up. So the first thing we're going to look at is narcotic agonist analgesics. And we call them opioid agonist analgesics. Like I said, we use that kind of interchangeably. And we start talking about these types of meds on pages 214 and 215 in your textbook. And what these do is, as they bind to the receptors, one of the side effects by producing reactions in those receptors is to prevent the perception of pain in the central nervous system. It's not that the pain is gone, it's just that our central nervous system doesn't feel it the way we did before. Along with analgesia, or pain relief, which is the therapeutic response, these drugs can also produce sleepiness, euphoria, which is a feeling of great happiness. The people usually are not thinking as clearly as they otherwise would. Physical reactions can be slowed breathing. Meiosis, which, if you remember, is the pupils constricting. Decreased peristalsis in the GI tract. A reduced cough reflex, and then hypotension. Tends to be a certain amount of vasodilation and the blood pressure drops. So we use these opioid agonists to treat moderate to severe pain. Like I said, we use those terms kind of interchangeably. Narcotic, you tend to see in a more legal sense, while opioid is considered more of a medical term. Remember I said the drug of choice for opioid agonists is usually what? Yes, morphine. Adverse reactions that can come about are discussed on page 215. They are central nervous system depressants, these opioids, so they can cause slowed heart rate, a decreased blood pressure because the blood vessels in the arms and legs dilate, and breathing is going to slow. Along with that, you might get very sleepy. People on opioids kind of get to where, they don't care a lot about a whole lot of things when they're on this because they're just so relaxed. They might be a little bit confused, especially elderly can get very confused taking opioids. They can, because they slow the GI tract down, they can cause a lack of appetite, so anorexia. You will have constipation if you are taking opioid agonists. Like I say, you might be a little bit confused, but you also might be extremely happy, depending on the drug and the way it acts on your particular receptors. You can get dry mouth, vomiting. Some people get extremely nauseated using one or more types of opioids because their vomiting center is stimulated by the action of the receptors. This doesn't happen to everybody, but it can happen to some people. Pruritus, you get itching, and sometimes you'll have a rash. And it doesn't necessarily mean the person is allergic to this drug. It's just how their receptors react. I'm going to stop here, and then we'll talk about a PCA pump, which is patient-controlled analgesia, and that brings up a whole bunch of other issues.